What if I told you that one routine medical appointment after the age of 70 could quietly change the course of your life? Not because you were seriously ill, not because your body was failing, but because one harmless-looking test started a chain reaction your body was never meant to go through. Picture this for a moment. You're 76 years old. You wake up early. You make your coffee the same way you've made it for years. Maybe you water the garden. Maybe you walk the dog. Maybe you drive to meet an old friend for breakfast. Life isn't perfect, but it feels stable, calm, familiar. Your energy is decent. You sleep fairly well. You still enjoy your independence. Then one day, during a completely routine appointment, your doctor says something that sounds harmless. Let's run a few extra tests just to be safe. And that phrase, just to be safe, sounds responsible, caring even. Most people never question it. But weeks later, many older adults suddenly find themselves in a world they never expected. More scans, more specialists, more medications, more procedures, more fear. Not because they were suffering, not because they had symptoms, but because modern medicine found something small, uncertain, or slow-moving. And once it's found, the medical system rarely leaves it alone. Today, we're going to have a calm, honest, evidence-based conversation about 5 routine medical checkups that many experts now believe deserve serious reconsideration after age 70. This is not about avoiding doctors, it's not about ignoring your health, and it's definitely not about fear. It's about understanding one very important truth: the balance between benefit and risk changes as we age. A test that helps a healthy 50-year-old may create completely different consequences for a healthy 78-year-old. And unfortunately, very few people explain that clearly. So in this video, we'll walk through which routine screenings deserve a second conversation after 70, why certain tests can create unexpected complications, what research is actually showing, and most importantly, what questions you should ask before agreeing to any procedure. Because sometimes the healthiest decision is not doing more. Sometimes it's understanding what truly improves quality of life. And stay with me until the end, because I'm going to give you a simple 5-question framework that can completely change the way you speak with your doctor forever. Now, before we begin, I'd love to know where you're watching from today. Leave your city or country in the comments below. I genuinely enjoy reading them, and it helps build this community of thoughtful adults who care about aging wisely. Let's begin. First, there's one concept you absolutely need to understand before any of this will make sense. I call it the longevity lens. When someone is 45 or 50 years old, preventive screening often makes perfect sense. You detect a dangerous condition early, treat it early, and potentially gain decades of healthier life. That math is straightforward. But after age 70, several important things begin to change. First, many abnormalities discovered during screening grow extremely slowly. Some may never cause symptoms during a person's lifetime. In other words, a finding on paper does not automatically mean a dangerous disease. Second, the body becomes less tolerant of intervention. A procedure that feels minor at 52 can become physically exhausting at 78. Recovery takes longer. Complications become more common. Muscle loss happens faster. Hospital stays become harder on the brain and body. And third, this is the most important part. There's something researchers often call the cascade effect. One small finding leads to another test. That test leads to a biopsy. The biopsy leads to a procedure. The procedure causes a complication, and suddenly, a person who felt completely fine months earlier is dealing with fatigue, medications, appointments, and loss of independence, all from a test they assumed was routine. That's the longevity lens. And once you understand it, you start looking at healthcare differently. Now let's talk about the first routine checkup many adults should reconsider after 75. Routine colonoscopy. This surprises many people because colonoscopy has absolutely helped save lives. There's no question about that. But context matters. Imagine someone who had normal colonoscopies in their 50s and 60s, no family history, no symptoms, no concerning digestive changes. Yet at 76 or 77, they're still automatically scheduled for another screening. Here's what many people don't realize. The preparation process alone can be extremely hard on older adults. The dehydration, the electrolyte imbalance, the physical stress on the kidneys, the exhaustion from fasting and bowel cleansing. For younger adults, it's unpleasant. For older adults, it can sometimes become dangerous. And then there's the procedure itself. Although uncommon, colonoscopy carries real risks: bleeding, bowel perforation, infection, sedation complications. A younger body often recovers quickly, an older body may not. This is exactly why many medical organizations now recommend that routine colonoscopy screening after 75 should be individualized rather than automatic, especially for adults at average risk with previous normal results. And here's another important point. Many colon cancers discovered very late in life grow slowly enough that they may never significantly affect life expectancy. That doesn't mean ignore symptoms. If someone develops blood in the stool, sudden weight loss, persistent digestive changes, severe abdominal pain, or anemia, those symptoms absolutely deserve medical attention. But there's a difference between investigating symptoms and aggressively screening healthy people without symptoms. For many older adults, less invasive options may make more sense. Annual stool-based tests, fit testing, or simply discussing whether continued screening is necessary at all. The key is having the conversation, instead of assuming every routine test remains equally beneficial forever. Now let's move to the second checkup: aggressive cancer screening in low-risk older adults. This includes things like frequent PSA testing for prostate cancer, annual mammograms in very elderly adults, or repeated imaging without clear risk factors. Now let me be extremely clear. Cancer screening can absolutely save lives. The problem is not screening itself. The problem is overdiagnosis. Modern imaging technology has become incredibly sensitive. It can now detect tiny abnormalities that may never become dangerous. Tiny, slow-growing tumors, very low-risk prostate cancers, small findings that might remain harmless for years. But once those findings appear in a report, the emotional pressure becomes enormous. Most people hear the word cancer and immediately assume aggressive treatment is necessary. And that's where many older adults unknowingly enter difficult treatment pathways that may reduce quality of life more than improve longevity. For example, some prostate cancers in elderly men grow so slowly that they would never realistically become life-threatening. Yet treatment may still involve radiation, procedures, fatigue, urinary complications, sexual side effects, and chronic stress. Similarly, some breast abnormalities detected through late-life screening may never become clinically significant. But once discovered, they trigger surgeries, biopsies, scans, and months of fear. This is why many physicians now encourage older adults to ask a very important question before agreeing to aggressive screening. If this test finds something, what would we realistically do next at my age? That question changes everything, because finding something is not automatically the same as improving life expectancy or quality of life. And often, that distinction is never fully discussed. If this conversation is helping you think differently about health after 70, type the number 2 in the comments below so I know you're still watching. Now let's talk about one of the most misunderstood tests in older adults: routine cardiac stress testing without symptoms. This one sounds incredibly logical. You're getting older. Heart disease becomes more common, so checking the heart sounds responsible. But here's the issue. In people without symptoms, stress tests can produce false positives surprisingly often, meaning the test suggests a heart problem that may not actually be dangerous. And once an abnormality appears, additional procedures usually follow: angiograms, catheterizations, stents, more medications. But here's what many people never hear. In stable patients without symptoms, procedures like stenting do not always improve survival compared to careful medication management and lifestyle support. That's one of the most important findings from major cardiology research over the last decade. Meanwhile, invasive heart procedures carry very real risks: bleeding, stroke, kidney stress, rhythm complications, recovery challenges, especially in older adults. And after a stent, many patients require long-term blood thinners, which increase bleeding risks significantly. So what actually improves heart health most consistently after 70? Not endless testing. The basics: daily walking, blood pressure control, blood sugar management, sleep quality, strength maintenance, smoking cessation, stress reduction, consistent movement. Those things may sound simple, but they are incredibly powerful. A healthy lifestyle often protects the heart far more effectively than people realize. Now let's discuss another controversial topic: bone density scans followed immediately by automatic medication. Osteoporosis is real. Falls are serious. Hip fractures can absolutely change a person's life. But again, the issue is not awareness. The issue is automatic treatment without full discussion. Many older adults receive a DEXA scan, are told they have reduced bone density, and are immediately started on long-term medications. But every medication has trade-offs. Some osteoporosis medications have been linked to rare but significant complications involving the jawbone or unusual thigh fractures after very prolonged use. That doesn't mean nobody should take them. Some people absolutely benefit. But the bigger issue is this: the single most effective strategy for fracture prevention is often not medication alone. It's fall prevention, balance training, leg strength, vision correction, home safety improvements, proper footwear, protein intake, vitamin D optimization, resistance exercise. Research repeatedly shows that improving balance and reducing falls dramatically lowers fracture risk. In fact, practices like Tai Chi and supervised balance training have shown remarkable results in older adults. Because many fractures don't happen simply because bones are weak. They happen because people fall, and preventing the fall changes everything. So before automatically starting years of medication, it's reasonable to ask, what is my actual fracture risk? What lifestyle changes could help first? How much benefit would this medication realistically provide in my case? Those are smart questions. Not difficult questions, not disrespectful questions. Smart questions. Now let's move to the fifth and perhaps least discussed screening of all: routine carotid artery ultrasound in people without symptoms. Most people have never even heard of this test until a doctor suggests it. The purpose is to look for narrowing in the arteries of the neck that supply blood to the brain. The theory sounds simple: find blockage, fix blockage, prevent stroke. But reality is much more complicated. Many older adults naturally develop some degree of artery narrowing with age, and in many cases, it remains stable for years without causing problems. But once it's discovered, procedures may follow. And here's the concern: procedures designed to reduce stroke risk can themselves carry stroke risk. That's why several medical guidelines recommend against routine carotid screening in adults without symptoms, especially if they have never experienced warning signs like temporary weakness, vision loss, speech difficulty, facial drooping, or mini-stroke symptoms. Because again, the goal is not simply to find abnormalities. The goal is to improve real-world outcomes safely. And often, controlling major risk factors provides greater protection. Healthy blood pressure, exercise, cholesterol management, diabetes control, avoiding smoking, maintaining activity. Those things consistently reduce stroke risk without procedural complications. Now, before we finish, I want to give you the most practical part of this entire video: the 5-question framework. Every adult over 70 should bring these questions into every major medical conversation. Question number 1. What is the false positive rate of this test for someone my age? Because a test that frequently creates unnecessary alarms deserves careful thought. Question number 2. If this test finds something, what would realistically happen next? This shifts the focus toward outcomes, not fear. Question number 3. What are the risks of the treatment or procedure being considered? Every intervention has trade-offs. You deserve to understand them clearly. Question number 4. Could monitoring this safely be an option? In many cases, careful observation may be completely reasonable. And question number 5. What non-invasive approaches might help first? Because lifestyle interventions often remain incredibly powerful, even later in life. Walking, strength training, nutrition, sleep, social connection, stress reduction, balance work. These things still matter enormously. And finally, I want to leave you with one thought. After 70, healthcare should not become a never-ending search for abnormalities. It should become a thoughtful strategy for protecting independence, mobility, clarity, energy, and quality of life. The goal is not to turn healthy older adults into permanent patients. The goal is to help people live well for as long as possible. Sometimes that means doing more, sometimes it means doing less. And often, wisdom is knowing the difference. You have every right to ask questions. You have every right to understand risks. And you absolutely deserve healthcare decisions that reflect your goals, your body, and your priorities. If this video helped you see health after 70 from a new perspective, subscribe and join us here each week. We focus on practical, research-based conversations designed to help adults age with more confidence, more clarity, and more independence. And before you go, tell me in the comments, have you ever had a routine test lead somewhere unexpected? Your experience may help someone else make a wiser decision at their next appointment. Take care of yourself, and I'll see you in the next video.